Yes, 9 o'clock, the 16th of June, in the middle of the year, actually. And you tune in to Living as You Are every Saturday morning, and this voice comes to you, 9 to 9:30, to teach you little bits, nice food, medical food, I would call it, to keep you alive. I'm here not to give life, only the Lord does that, but we as doctors, we help you to prolong this life. So I'll come back and talk to you in a few minutes. Living 9 to 9:30 every Saturday. Yes, as Bob says, lively up. Live a little, laugh a little, smile a little, and laughter makes the heart glad. So you're stressed out, you know, buy a book and read. Comedy and laugh. It soothes the soul. It brings your heart rate down and bring out the good in you. Don't think that you're the only one stressed out. The world is stressed. So, good morning again. Happy Father's Day to all you fathers tomorrow. And you little children, give Father a gift, even if it's a little card. Tell him you love him. Yes, we love our mothers, but we have to love our fathers too. They're the leaders of the home. Write a little note to him if you can't get a card and say, Daddy, I love you. And you fathers, don't forget to say to your children, you love them. Sometimes we think we are macho and we don't say these things, but that word love means a lot. Tell them you care. So, here we are today. There's Josephine Roach and Elon Roach. They're my friends. I love them, and I haven't seen them for 6 years or so, and I call their numbers, and I can't get them. So, Josephine and Elon, if you're hearing this, call me. I miss you guys. This world has some beautiful people, and you're definitely one of them. Life and death, an enigma. It has plagued me, and as I said to you many times before, it bothers me. It bothered me as a child and still bothers me. No matter what I do in life and how much I achieve, I'm always fixated on this Passover. And you know what happened this morning? I got up and I was reading the Word, and I read Ecclesiastes 1 and 2, and found out that Solomon himself, he pondered over these things. What about you? Do you think about dying? You think about when you leave, what happens? You ever thought about it, that this world keeps going around, and if you leave, it doesn't affect the world? People may stop for a second or two, immediate family, and some people would not even care. So, what is it? You were brought here in this world, and I don't know, but it bothers me, and I don't know if that could have been a nidus for my evolution into medicine and going into cardiology and so forth, you know? But today we're going to do some biology. I'm going to teach you some stuff about the heart and the blood vessels and so forth. I mean, I was stunned that a fella came to me and says, Doc, he came from overseas. He says, we heard you were the best in the Caribbean. I said, that's so. I said, what do I do? He didn't know. So I don't understand. And I've been talking about stuff all these years, and still people don't even understand. Some people don't know what a heart attack is. And today I'm going to teach you, and I would like you to write it down, because it's important. Life is about probability, and you will. What's the chance of you leaving this world from cancer? Or, from the foot, cancer of the lung, or some other entity, whether it's sickle cell problems, or whether it's some problem, infection with some type of pneumonia. No. You are more likely to die of a stroke or a heart attack. It's the number one cause of death. So you need to know about it. If not for you, for your family, because we all have mothers and fathers and so forth, okay? And don't forget, men are affected by heart attack more than women. Tomorrow's Father's Day, so we want to make sure that we key in today and learn some biology. I think I'm qualified enough to give you a lesson in biology. Did biology in Long Island University, 4 years of college. I majored in chemistry, actually, as a chemist, but biology was my minor. And then I went on to New York Medical College and did the section, 4 years of microbiology and the section of cadaver and all those type of things. So we were able to see the arteries and see the organs when they're alive and when they're dead. Then I did general surgery. Patients used to come in, 2 years of that, actually, in Brooklyn College, Brooklyn Hospital. Come in with gunshot wounds and all kind of stuff, and had to be called along there and massage their heart and stuff, try to save lives, and not to mention 3 years of internal medicine at New York Medical College. At St. Luke's Roosevelt Hospital in New York City. And then I did cardiology, 3 years of that in Jacksonville Medical Center. So, and then after that, I went on and do my attending and training. So, 17 years of hard work and studies. I can give you a little course in biology at least. So, I'm going to play a song and then I'll come back and we'll start and talk about arteries, veins, capillaries, and we're going to loop it all into this network, and you'll know by the end of this half an hour, you'll know what a stroke is, and what a heart attack is, and what you should do. I got a caller. I'm going to take a call about this 434-1771, 434-1790, 434-1791, and we will, you can call me in between, we'll talk and we'll chit-chat. Good morning.
Hello, Dad.
Excuse me, Ashley. How are you doing?
Daddy.
What?
Happy Father's Day.
All right, thank you, Ashley. Good, I appreciate that. That was very good. So that's wonderful. Good. All right, I'll talk to you when I get home. So that was my little girl. You know, we learn from children, actually. Yeah. Thank you, and happy Father's Day too. You know, we learn from the babies. The Lord said that. I was striving to work one day, and she said to me, Daddy, I want to talk to you. And this girl is 4 years old. I says, well, yes. She says, you get angry and you shout. You shouldn't. You should calm yourself down and then tell the person you're sorry, and they will listen to you. And I sat there and I says, imagine, 4 years old. I should know that. And she's telling me what to do. So nice. Thank you, Ashley. And happy Father's Day to all you guys out there, you know. It's wonderful. Tomorrow's our day. Relax. Don't do too much work. Relax and get a little bit of TLC from your family tomorrow. So let's start the biology. You can call in and I'll talk to you. But somebody's on the line there, and they'll hold on for a little bit while I just start off. Arteries. What are arteries? The arteries, the whole vascular network is made up of these, is a tube of 5 liters of blood that has to go through your body. And it goes from the heart, which is a big artery, actually. The heart is like the size of your fist. And this is like it's a hollow tube there that's like just pulsing, like if you blow a balloon. That's the heart right there. And then the tubes now, leaving it, are thick. And they're called arteries. They go and they distribute blood to every part of your body, and then they come into smaller tubes called arterioles. And then after the arterioles, it goes into these small little vessels called, very thin, it's called capillaries. Now the capillaries, the blood and all the nutrients can come out of all the food that is in the blood comes out into the capillaries, feed the tissue, the cells, and then the cells, the waste matter from the cells, go back into these capillaries and then goes through a thinner, bigger vessels called the veins. The venules are the smaller veins, then that goes and get bigger into the veins. The veins now go straight back to the heart. And you see the circulation there. The heart is pumping the blood. Blood goes through these arteries. all to the entire the head, the kidneys, the foot, the hand, everywhere. Get the smaller arteries called arterioles, and then the arterioles change into capillaries, very thin vessels in the skin, and all the skin, which is the largest organ, and all of the other organs. And the fusion of oxygen and nutrients go on with the cells. Then the cell says, hey, I don't all have this carbon dioxide and all the waste matter. Put it back. It goes back into the capillaries, which goes into the venules, then to the veins, and that go back to the heart. And that process continues every pump. Boom, boom, 120 times a day. Isn't that really cool? Now, that's what should happening. You look at the cars, it's almost the same thing happening. I think they designed the cars after the body, you know. The carburetor, and then the blood goes, and then the gas goes through all of those tubes and then come right back, circulate. That same type of process goes on. Now, the pressure in the arteries is very high compared to the veins. Because of that, a lot of changes can occur in the arteries, and I want to talk about that today, because that is what's going to lead to the stroke and the heart attack. But do you know that there was a study done here? If you guys listened to the program last night and Doctor on the Line, you would have heard me talk about the National Registry. Done in here, we did some studies here, and we study our patients retrospectively and so forth. And the registry is still going on, but in 2009, in a 6-month period of time, they looked at the amount of the heart attacks that entered the Queen Elizabeth Hospital. You had 182 heart attacks. Before I tell you the statistics, let me tell you what happened. When you get a heart attack, 1/3 of the people die before they even get to the hospital. That's 1/3. That's 33.3%, okay? Die before reaching the hospital. Now, let me tell you what happened here in this country at the Queen Elizabeth Hospital. 182 people came in. You know how many people were admitted to the hospital? 50. It means that the rest died. That's 132 people died even before being admitted. And out of the 50 that was admitted to the hospital, 16 of them died. So out of all these 182 people, we were only able to save 34, which is about 16 to 17%. Half of what the average in the United States and the developed countries are. Said 1/3 would die before getting to the hospital. Now we have, out of all the 182, only 16 to 17% we can save. 34. Not good enough. So we have some work to do. That is why I'm saying to you, it's serious. And when you get a heart attack, by the time I'm finished with you this morning, you will know. We got another doctor by the name of Dr. Steinberg, cardiologist, interventional cardiologist like myself, will be coming to talk to you in a couple of weeks. So he will share, help me to, we're here to keep you alive. We got a caller? Good morning.
Good morning, Dr. Sparman.
Yeah, good morning.
Happy Father's Day to
Thank you. Thank you.
And God bless you.
Thank you, ma'am.
Dr. Sparman, I have 2 questions for
Please.
you. Have they done any research comparing brand name drugs with generic drugs? Because I noticed when you're on the programs, the television programs, when you're talking about the best heart medication and diabetic medication, you're going by the brand name.
Right.
So when you have a patient in your clinic, what is the best heart medicine and diabetic medicine that you prescribe?
Oh, thank you. Very great question. You know, and it's a question that comes up all the time. Yes, the brand name stuff, it has to do with just publicity and all kind of money issues, because people, life is about perception. And if you perceive that something is the best, then for you it's the best. Let's say, for instance, Plavix. Plavix is a drug that is used if you had angioplasty and you have to take it for 1 year. Or also it's used also for people who are allergic to aspirin. Plavix would be the second best drug if you have heart disease. The other name is clopidogrel. Clopidogrel is a generic name, it's cheaper. The country we have in this country at a certain price. If you buy the brand name, it's more expensive. And guess what? It's the same thing. The same percentage, actually, of the drug is in Plavix that is in clopidogrel. It just means a different company made it. And so it's like wearing a shirt, Tommy Hilfiger, as opposed to some other Banana Republic. The same shirt, do the same thing, but what happens is that people perceive that Tommy is the best. So that's the way it is.
And one more question,
yes.
sir.
Oh, she got cut off. I'm sorry. You can call back. But yes, so if now the cost factor in this country, it's really hard times. We're going through a crisis in the world, actually. So what I do for my patients when they come in to see me, I try to do it, give them the generic drug so that it would have a less effect on their pocket. I'll try to give them clopidogrel or simvastatin instead of Zocor and so forth. So yes. Good morning again.
Good morning, Dr.
Yes,
Sparman. The other question I wanted to know is, are both the generic and the brand name drugs FDA approved? Okay,
well, yes, and that's a very important question, too. A lot of the drugs that we use here, I have to be honest with you, and I'm always upfront with my patient. A lot of them are not FDA approved. They don't go through that system. The Federal Drug Administration in the United States, they have very strict criteria for drugs, and for it to be used in the United States, it has to pass through the FDA. But the whole world is not governed by the FDA. Here in Barbados, we use drugs that are extremely good, as proven by studies to be very good for our patients, and even though it may not, most of them are FDA approved, but some of them may not be, but they are used in England and Canada and so forth, which follow a different system. All the drugs used in England would not necessarily have to pass through the FDA. So every country and every law drives or mandates what's done there. But I assure you, the drugs that we prescribe to our patients here are safe and they're extremely effective. So the generic versus brand name, basically the same.
Okay.
Thank you, ma'am.
And the last question,
yes.
One more question. When it comes to our airport and our, you know how excited and agitated us older people get when we have to travel these days.
Yes.
Do they have a I think it's fibrillator?
Oh, a defibrillator, yeah.
Yeah. Do they have one now?
Yes, we do have one in the airport, more than one, actually. That's, and as a matter of fact, many of the hotels have them. And I can tell you right now, that's a fact, at least, like the Crane Hotel and some others. I've seen patients where they had to be, the defibrillator had to be used to bring them back to life. And I've been involved in many such cases and saved their lives. So the defibrillator is very important. I agree with you. It has to be certain points. As a matter of fact, it's something right now should be, every area should have it. But yes, it's at the airport.
Thank you very much.
Pleasure, ma'am.
You answered all my questions.
Thank you. And
God
have a nice good day.
Happy Father's Day.
Thank you again. Thank you. So, yes, I will come back. I'm not going to take another call right now because I might have to do biology number 2, part 2, next week. Let me play something, and then I'll come right back, and we'll wrap the session up. How about Bob Marley? That's my boy. You know, I love him, so we'll go back. Turn your lights down low, Bob Marley, and I'll be back. I want to tell you, if you're having a stroke, I can't complete this biology class today. I'll continue it next week, okay? But we talked about the arteries today, we talk about the veins, and we talk about the heart. And the blood goes through the arteries to these organs. And when you get as you get older, there are plaques that form in these arteries that occlude them and cause the tissue to die. If the artery going to the brain get clogged up, it's a stroke. If the artery going to the heart get clogged up, it's a heart attack. If the artery is going to the kidneys, a renal infarct. If the artery is going to the lung, it's a pulmonary embolus. They all are lethal. So we'll talk about that, but I want to give you a tip that is extremely important. The previous caller talked about a defibrillator. It's important to have them around. And hopefully soon this country will have more of them, because when someone is having a heart attack and they're out, sometimes most of them would have a ventricular fibrillation where the heart is going 500 plus beats per minute. One shock and you can bring them back. That is why I talked to you about the precordial hump, which acts like a defibrillator. You hit the patient very hard in the chest, and sometimes it jolts the heart back into rhythm. We'll talk more about that next week. You're going to tune in and we'll talk about that. But you have 3 hours if you're having a stroke. You suspect someone having a stroke, 3 hours to bring them to the doctor. We've got these thrombolytics that can go in there, remove the clot, and restore blood flow to the tissue so that you can regain your function in the stroke. We could minimize the effect of the stroke. 3 hours. But a heart attack, you got 6 to 12 hours. Come in, the sooner the better. We want you early. We can give you the thrombolytics and stop the muscle from dying around the heart and save you from death. So this is a stunning figure that we have. 16% of the heart attacks in 6 months in 2009 that we were able to save. We can increase that if you come early. You suspect yourself of having heart problems, especially if you have risk factors. Please, don't forget, you come to the doctor sooner than later. I want to thank you for listening. 9 to 9:30 every Saturday. Don't forget to tune in to www.sparmanclinic.com, that website, and it'll tell you if you missed this program. You can go on that website and you'll see it there living, and you can play and listen to all the things, all the past programs. They're all there for you. Dr. Alfred Sparman, dr.sparman at sparmanclinic.com. I'm here 9 to 9:30 every Saturday. Love you. Have a nice, happy Father's Day tomorrow. And I look forward to see you next week. God bless you. And here is Tracy Chapman, actually. Give Me One Reason. I always like this song, actually. So we'll just play a little bit of that for you. And then I will see you. You be good. Tell somebody you love them. Tell somebody you care. This is your good doctor, Dr. Sparman. Until next week.